Yes, good afternoon. And being Thursday, we're looking at what our numbers are today and how they've been for the week, how we're doing, and what we're looking forward to in the weekend coming up. As you know, and people have noted that our daily numbers have been above 100 and some days above 150. We haven't crossed over the 200 mark. Today, we're back down to 170. That's up from 149 yesterday. So that is something we're watching and observing. We unfortunately did report one further death, and we have had a number of days with no deaths. So we would still like to see that continue at zero every day if we could. And we've had 142 further resolved cases coming in. Looking at the numbers, and this has been the trend for the week, and last week when we were up in the 190 and coming back down again, is that the majority of our cases are concentrated in our more densely populated areas, the typical ones being Toronto, Peel, York region, and Ottawa, somewhat in Durham a little bit today. But for most of the province, they have remained fairly quiet, with 28 of the 34 reporting less than 5 or fewer cases today, and 14 again reporting no new cases, and some have been at no cases for quite a period of time now. So that is encouraging, but it shows the variation we have within the province. I should say that Toronto today had 55, York 28, Peel 22, and Durham 13, and Ottawa down to 12 from a higher number yesterday. So where are these numbers coming from? And we've been trying to look at that and assess that. And I'll talk about school opening in a moment. These numbers usually have been related to, I would say, social or family type gatherings. We do have some workplace outbreaks as well that are going on, and some are related to some larger events. In Toronto, we had one related with York and Peel with a wedding type event, and that had some number of cases in each location, and that has been contained. And we also have some others related to some larger type of outbreaks in industry or locations and workplaces, and those are being pursued, and all the employees being tested and followed up as per our protocols and monitoring that situation there. We have had some aspects related to the school openings in that, and I would say that I'll talk about the school openings in a second. I think some people have been concerned that we should be looking at some other locations and how we're going to deal with our staging. We are in our, for most of the areas, 4 weeks of stage 3, and our numbers, we're watching all the new venues that have opened up to see what is occurring. And in spite of some of the comments, we haven't seen a lot related to restaurants or those type of retailers or to bars, except one location in Toronto once. But other than that, we continue to watch and observe and see what is happening. And so if there were some issues in those different locations, we would seek to deal with those as they come up. But so far we have seen not a lot of activity there. We applaud the owners and the proprietors of these locations who have taken, it seems, our reports of very good steps to maintain the public health measures recommendations of the distancing, masking, and people staying at the tables, as well as taking turns to use the facilities and protection of their staff accordingly, with proper hand hygiene available and alcoholic hand rub. So that seems to have gone well so far, and I think a number of the owners as well as the patrons have been careful about using these facilities and have appreciated their availability, again, to all sectors of the province. So we'll continue to monitor that situation. In the school aspect there, it's a busy time for everyone. Schools have opened up, schools are opening up, and schools will be opening up. So there's a lot of different ones happening at different times in different parts of the province. And so we're monitoring that situation. We have our health units in place, working along with the local boards of education, with the principals and administration, and those are connected both with their public health nurses. We've pretty well gotten close to hiring our 500 of our first cadre, and that's gone really well. And to have them in place for the different locations and to ensure that they are connected well with each school, and are made accessible to various groups such as teachers, administration, parents, and sometimes in the high schools even students who may want to ask questions and who seek to get clarification on different aspects related to infection prevention control. And as I was saying to one media station already, it's a busy time. Anyways, and I remember years of getting ready. That first week back at school after a summer off is people getting back into routines that sometimes were forgotten about, getting ready for, getting prepared for, going to, attending activities in the school, and then coming home again. And add to that, it's been a longer period out for everybody, not just 2.5 months. And then add to that, now we're throwing in infection prevention control. That means assessing health before you go, assessing any risk exposure your children or you may have had and that you may choose at that time. And I think fairly enough and responsible enough, maybe say to stay home and monitor that situation until you're satisfied that you have all the information you need. So one, don't go to school if you're sick. If you're an employee, don't send your child to school if they're sick or feeling unwell and you're not certain what's going on. Take the time to have it assessed and look at it properly in that regard. And as also make sure you give all the equipment that's needed for the child, both masks and other materials, including advice of how they should behave in the school setting. And this affects also with getting transportation, whether you're driving to and letting off or whether you are taking buses. And we had some issues with in the Ottawa area where there was some lack of adherence to the full principles of the school busing. As a result, a number of the some cases were located and notified on the bus, and those ones are now in isolation. The contacts are the members on the bus, and so we're being extra careful in this. And other cases we've identified early on, and these are important to have because it tests, one, the prompt reporting, the testing, turn around the testing quickly, the public health interventions to assess the adequacy and quality of the PPE, as well as the other public health measures in the facility. As a result, none of the cohorts in the schools were closed. None of the schools were closed because proper steps were taken, even those schools that had already been opened a week ago. So this is important tests of the system, because our approach to the school system is not that we don't expect any cases. We do expect some to occur. We'd like not to have any, but we're not going in with that a foundation of our beliefs. We're going in and saying if there are ones, we want to know about them quickly, get them assessed quickly, deal with minimal disruption to, one, the school, the classroom or cohort, next to the family and family members and friends, so we can quickly cordon it off and deal with it, assess it, and determine if it's a real risk, yes or no. And it's the robustness of that system we're really trying to invest in at this time. So, so far that is going as we planned. There still is a lot to get done, a lot to move forward on. There's lots of activity happening in all the different boards and schools as they get ready for this very important investment in our children's mental health, developmental health, as well as their social structures and things that they're excited to get involved with. And I think with the proper things in place, we can do it with safety and look out for any problems and deal with them in a fairly quickly and in a very efficient and effective way to minimize any impact upon the system in that. So those are my general comments on that. I would say in regards to our cases that there seems to be some confusion with the public where they assume that because we went to 50 indoor and 100 outdoor, and that means like a backyard gathering or an event, that gathering is carried out without any other social or public health measures. That is definitely not the case. We said you could have 50 inside or 100 outside, maintain the public health measures, the 6-foot distancing, unless it's in your same social circle, a family group, whatever, that you had before. It doesn't mean you just sort of go and randomly carry on with everybody like a big party. That's not how it is. 6-foot distancing, masking if you can't do that, and hand hygiene. And if you're sick, don't go to the event. So those same stipulations are required in the 50 indoor and the 100 outdoor. So the big backyard party with everybody just doing everything like it was 2 years ago is not acceptable, as the Premier said. And I would back him up on that. And we really have to take this seriously, because if we can't we want to keep our community numbers down. Those down will keep it safer for our schools to open and make it for a better school entry year and start for the year ahead of us. So I want to remind people, don't let your guard down. Now's the time to be careful because we're coming into viral respiratory season again, and these steps will protect you from COVID, will protect you from flu and other viruses as well until we get our influenza vaccination program out and running. And we hope to do that as soon as we get the vaccine available, and we put all our plans are in place to get that ready to roll. And we're going to do our best to get to one of our highest uptakes of vaccines this year, and we need your cooperation and everybody doing their part in this. So I've said enough for now, so I'm going to open up for questions from the media. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question comes from Chris Herholt from CP24. Please go ahead.
Hi, Dr. Williams. Despite the pause announced by Minister Elliott this week, dozens of criminal courts are going to resume holding preliminary hearings and full-on trials next week. At the end of the month, 11 casinos in the province will reopen. Would it not be prudent to intervene to postpone these moves for the time being, given the recent rise in the caseload?
It's a good question. We have put out the guidelines already for the casinos that will be opening. That's staying within the 50 in a room location. There's all sorts of checks and balances they're supposed to adhere to. Some may say that's not a large enough number that they would like, but that's what we're sticking to at this moment, and ask them to stay that course, same as convention centers, which we put those guidelines up before. As far as the other things with the courts and systems and that, we have given some recommendations regarding selection of jurors, and there's a number of checks and balances that the different systems are putting in place, including barriers, distancing, and we'll be continually appraising that situation as it opens up. And I know that their system, their people, their legal counsel, etc., and the judiciary system is very concerned about this, and they too want to make sure if it's going to be undertaken, where there's a large backlog and there's a lot of work to get done, and people are really needing to deal with some issues, that they want to do it in a way that's safe for all patrons, all individuals, I should say, who are involved in the court cases and settings. But there is a backlog and a lot of issues to be handled, and so there is a pressure to do that as well. But it doesn't mean we can't do it safely. So we're trying to put all those guidelines and directions in place, and we'll assess it on a go-forward basis.
Follow-up?
Right. So given what has been reported recently about private gatherings in homes being the main driver of new infections, is now not the time for you to order a reduction in the size of indoor private gatherings across the province, excluding restaurants and bars, which you say are not the problem, but specifically indoor private gatherings and the 50 number? Is it now not the time to do that, especially as cooler weather is about around the corner?
Yeah, that's a good question. We were aware that already before we upped to 250 from the smaller number, some were already undertaking to have these type of events anyways in their own private settings and disregarding the public health measures. We assumed that by going to the 50 and saying, okay, you can have 50 or a larger number in an outdoor venue, such as at a wedding or some other activity, but you still have to do the proper social distancing and the public health measures. So we would prefer more that is done. It's more that the people's adherence to those standards is important. The size, even if you went down to 20, if you're still just having a gathering, it's not in your social circle, you still have the potential for spreading it, and it would be against our policies around public health measures. So we'll watch that if we have to push back on that. But we have a number of retailers that are undertaking to do that 50 indoor and 100 outdoor that are putting in a lot of steps and processes to ensure that they're doing that safely in regard and totally respecting the public health measures. And we don't think we have to punish them for that one because their business depends on it. And I think what I've seen so far, they put a lot of time and effort into doing it correctly, safely, and consistently with our measures. So there's a balance in there. And the public, I think, are assuming that because it's a private event, it isn't constrained by these rules. It is. And you have to make sure that this is not a social circle. This is the same constraint, and you still have to adhere to it and can face some challenges if you're complained upon, if you're not adhering to that method.
Next question.
Next question comes from Michelle McQuigg from Canadian Press. Please go ahead.
Hi, Dr. Williams.
Hello.
Earlier today, the Premier started talking about measures that were underway or at least under discussion to address the backlog of surgeries in the province. He pegged the number at around 180,000. There was some research in the Canadian Medical Association journal earlier this week, or last week rather, suggesting it was closer to 150,000. One of the proposals that the Premier floated was the idea of having doctors start working weekends in order to address this backlog. He mentioned that there's discussion underway with the Health Roundtable and the Ministry. As a member of the Roundtable, would you be willing to shed some more light on this proposal of the Premier's to have them work weekends and maybe share any other proposals that might be under discussion as well?
To be honest, I hadn't heard that specific proposal. I know that our command table with Ontario Health and with our other assistant deputy ministers and their various portfolios are in discussions with the various physician groups at this time and the various hospital sectors and others to seek all ways possible to deal with the backlog of elective and semi-elective surgeries. Everybody is putting their energy into that. That's part of why we're trying to keep our numbers down to ensure that the hospitals can deal with the load. At the same time, being aware we want to monitor and watch it, that we have the capacity if we had to respond to a potential second wave or some blips in the so-called different patterns of the fall, that we're prepared for that. So we're putting all our fall plans into that. As for that specific issue, I really can't comment on that at this time because I was not party to that discussion, but I'm sure we can take that back and someone could get back to you on that matter in that from our staff here, so we can try and shed some more light on that for you if we can.
Follow-up?
I appreciate that. Thank you very much. Yes, another follow-up, again, to do with remarks coming from the Premier today. He was looking a little further ahead than where we are at the moment, but he was looking ahead to Thanksgiving and to Halloween. And he was expressing some nervousness at the idea of allowing some of those festivities to go ahead, namely kids circulating through different neighborhoods. What are your thoughts on that notion? The Premier was urging some caution there. What would your take be at this point?
Well, Thanksgiving, I think, is probably more of a family type event, and that'd be like our comments before with the social gatherings where you may have more than just your circle in, and how you're going to undertake to do that, especially because the weather, who knows by mid-October what it would be like, maybe more of an indoor activity in that. As always at Thanksgiving, my concern every year before that was to cook the turkey well, because we have more than outbreaks of, back then, of COVID. We had other things related to food safety, so we don't want to let our guard down on that. The aspect around Halloween, it has been raised. Some aspects even looking forward to later in the seasons with different festive activities of how we might put checks and balances. If they're going to be undertaken, how could they be done in a safe way? So I know our public health measures table is trying to address some of those issues. Should it be limited? How should it be done? What's a safe way to do it? All those things that you're alluding to there. So whether it's an all or nothing, I think some feel it could be done with some sort of limitations, but I still have to be advised by my public health measures table as they look at the various nuances of Halloween celebrations and activities, because not just all the trick-or-treating, there's other events and things that take place at the same time that could be potentially spreading COVID, and maybe with some proper guidance and direction, some activities could still be allowed, but we'll get back to the public with that and for yourselves when we have those directives out.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Thank you very much. Good afternoon, Dr. Williams.
Lucas.
I will ask you to go a little bit out of your public health lane, if you will, but I did want to get your thoughts on what Quebec is doing with regards to mask enforcement, basically handing out fines to those who refuse to wear them, who isn't wearing them when required to, according to their own provincial public health guidelines, and it will really apply across the province. So I know this is more of an enforcement question, but I'm just curious if this is something that you would either maybe not per se recommend, but is this something that you think is a good idea? If the issue is people not following public health guidelines, as you mentioned, they have to even during these private gatherings. Is this something that you think would be a good idea for Ontario, or even just for the specific 4 regions where we're seeing these spikes?
So as regard to masking, because you asked a broad breadth of questions there, we have highly recommended masking in our public places, especially indoor, where you cannot be guaranteed of keeping your 6-foot distancing. A number of retailers have required that to enter their premises and have told individuals that they have to stay out or provide them with a mask during that time. Some health units have put out Section 22 orders requiring retailers and indoor facilities to require that as well. Out in the public spaces, that's been more latitude. I think the point you bring up about enforcement, in public health, we always are working with the public to get the public's cooperation and participation. It's much better if the public see the value of it, see the need for it, and support the function of it, rather than going around and trying to enforce it on one-off basis. We know that when we did some surveys and looking at how Ontario does compared to the rest of the country, whereas some of the country, the average is around the 50%, slightly higher than 50%, we were, even 3 or 4 weeks ago, up at 67 to 68% of the public who either wear them all the time or want to wear them all the time. And so I think that the public in Ontario's participation has been excellent. It's much better if people police themselves than us having to police them per se. And they will take even extra strides for protection, because not only wearing the mask, you'll be careful about hand hygiene, you'll be careful about your distancing, and being respectful of those around you at the same time. So how much we'd have to go towards an enforcement side, I think the more the Premier is concerned, if people aren't adhering in the private and family type gatherings and backyards, etc., that he was looking at more how to enforce that broader thing where you're not just doing masking, you're doing a number of things against the overall public health measures. And so there'd be some wider requirements to say you must adhere to these standards if you're going to hold an event like that in that regard, not just masking only. So I think public health participation, public health trust and confidence, and self-policing is more important to me than reinforcement. If it's really necessary and vital, we'll have to look at that in what circumstances and where it might be appropriate, and how one can do that in a way that is not just out for punishment only, but to continue to encourage the adherence to the overall standards and directions for the public writ large. Is saying we're doing our part, how come they aren't? And you want to make sure you're supporting the public, because it's the public who are basically, in this case, not voting with their feet, they're voting with their hands and putting their mask on and then keeping their hands away from everybody else and washing them. So we want to support the public in this regard. And so we'll take it on a one-step basis and keep working with our Ontarians, who I would say for the most part, majority, are doing a great job.
Yeah, so maybe just on that, Dr. Williams, what do you think would be a circumstance where, I mean, we say we'd have to look at that if things kind of change. What are some potential circumstances where we may have to look at, bringing in the same types of fines that Quebec is doing?
I think it would be a case where someone was either refusing to wear, where they're putting other people at risk by the activity, they're putting employees at risk, they're putting staff at risk in that, or they're putting vulnerable citizens at risk, whereas an obvious challenge and risk, I would say, exacerbation that was not being regarded carefully. So there was a disregard for the health of those around. And where it was very clear in our minds that an individual not only was not doing it because they didn't think about it or were just forgetful, there was actually intent to not adhere. And where others were put at risk and public at general were at hazard, much like you see on some of the airlines that are requiring people to wear masks for flights and different functions and that, for the protection of their attendants as well as the other passengers on the plane.
Next question, and this will be the last question.
Last question comes from Randy Rath from Sage TV. Please go ahead.
Hi, Doctor.
Hi, Randy.
I want to go back to Halloween. Do you see any way, short of all the kids dressing up like frontline healthcare workers, that we can safely have door-to-door trick-or-treating?
Well, I've had lots of people with good ideas. I think there'll be some good ones come forward. Everybody wearing a mask, I guess that was, some were doing it past Halloweens. I guess everybody's going to have to do it. In that, I'm not sure everybody wants, maybe they want to dress as healthcare workers and that kind of activity there. I think it's more how it's being undertaken. What are the ones that's really important for? So I'm going to be asking our officials to say, if there is a way to do it, how can it be done safely? And not as widespread maybe as it has been. How do you make sure that the various things are handed out in a safe and clean way? And again, we're looking at the protection of the children so that they're not bringing more than the candy back home with them after it's all over. And so while I think there's a way it can be held, I want to make sure that we're asking a wide group and input to say how it might or could be done. And if it can't be, then we'll have to take that recommendation accordingly. But I'm waiting for their way to look at it. I know there's lots of excitement in there. sometimes not healthy to eat too much candy at one time. So we have to look at those health factors as well as dental health, and to look at their ways to do it in a way that's safe and contained. But again, we're going to have to make sure we understand how it works in all different settings and jurisdictions, so it can be done consistently and in a safe and healthy way in a COVID reality that we face today.
Follow up, and this is the last question.
More sober note. Today's Suicide Prevention Day, and have you noticed? Do you know if there has been an uptick in the number of deaths by suicide during COVID? And can you outline what the negative effects of COVID have been on mental health in the province?
Well, that's a very important question, and I don't have the data and statistics in front of me. I've heard from various consultants and experts in the area. They've seen increase in the frequency and incidence of people seeking assistance and help. And those that have been more in isolation is not always a very good thing. And so we've been very concerned about that. That's one of the reasons why we're trying to open up. That's one reason why we tried to move quickly on the social circles. It's not always family. It can be members of a community group that really need to connect in a closer way on a regular basis, that maybe have been doing that for the last number of weeks or months as we had the social circles in there. Going back to school, we understand there's the mental impacts upon our children and other individuals in that way. So it's not something we're taking lightly. We've heard the recommendations of our experts that part of opening up the province, in a way, while it has some risk in opening up, there's risk in not opening up. And so we're trying to make sure we're sensitive to all those parameters, not just economic, mental health, physical health, and for some people, focus on other aspects, spiritual health, another one that they're trying to really lobby hard and asking us to be sensitive to. So we're trying to seek that right balance as we move forward, based on our numbers and how we're seeing them progressing and how we're doing on our overall efforts to contain and keep the number of COVID cases down, to have a safe opening and to deal with these other issues that may have been exacerbated during our lockdown period for this extensive length of time. So all those things are very critical as we seek to create the right balance at the right time with the right data to ensure the best thing for all, including protection from COVID.
Thanks, everyone.